Very good afternoon. Am I audible?
You are audible.
Okay, thank you. So, very welcome to all of you. So, on behalf of KI, I'm Manish Kumar. I'm a marketing manager with QI. So, we'll start the session at 2 o'clock sharp once all the participants. Yes, yes.
Zoom का वो खोलेंगे जी हाँ
So, welcome again, all of you. We'll start the session. So, our today topic for the webinar is ISO 7101, which is Management System for Quality in Healthcare Organization and Requirements. So we'll discuss about ISO 7111. And so today our faculty is Dr. B.K. Rana. He's a speaker with QI. So I request Dr. B.K. Rana to take further, sir. Welcome, sir.
Thank you, Anish. Thank you so much. Good afternoon, everyone. Good morning, good afternoon to everyone who joined. Thank you all for joining this special webinar on ISO 7101. Am I audible, Manish?
Yes, sir, you are audible.
Thank you so much. Thank you. So we got 100 very good response from many of you. We got 150 plus registration, but let's see how many actually are able to join out of those. But nonetheless, let's start with time and people can keep coming and joining. But before we move forward, I really like to introduce you all a very special guest in this webinar today with us. We are really delighted and we are really honored to have him with us in this webinar. So I introduce you to Mr. Anil Johri. He is here today. And Johri sir, very good afternoon and welcome. And thank you very much for your time and to join this webinar.
Good afternoon. How are you?
Good afternoon, sir. Thank you. I'm fine. Thank you so much for joining. And people who may not know, but most of you know in the field of accreditation and quality. But nonetheless, Mr. Johri is a former CEO of NABCB Quality Council of India. I think he did superannuated around 6 years back, 5, 6 years back from there. But last 5, 6 years, I think he has done more what he has done in earlier roles. As far as quality improvement is concerned, whether it is through accreditation or certification or conformity assessment or writing policy, advising governments and international national organizations. So I think he is busy, more busier than what he was in his regular job. So he is actually move around the world advising organizations in conformity assessment and many other related. But lately, surprisingly also, he is now more into healthcare business rather than a non-healthcare. Though he comes from his accreditation of certification bodies, management system certification, and so on. Obviously, there is a component of healthcare also if a hospital want to go for a 9,001 quality management system. But now he's more aligned to what's going on in not only India but around the globe in terms of healthcare, which is not just healthcare services but also medical devices, pharmaceutical, environmental sustainability, and also and so forth. So thank you so much, sir, once again for making your time to join this. And now I would like to, but I would, before I move, I would like to request you to please say some opening remarks as you feel like. Thank you. Over to you, sir.
Thank you, Dr. Anna. Actually, I logged in with the intent that I just wanted to have a hang of this standard from an expert who was part of the ISO working group itself. As you know, I'm not in the domain of healthcare, not a healthcare specialist. I have an outsider's interest in healthcare, you can say. You know, ISO 7101, I have been sort of looking forward to it for two reasons, I'll tell you. One, it's a surprise to me that after the success of ISO 9001 as a standard, I mean, we'll not talk about quality of certification, etc. But as a standard, ISO 9001 turned out to be a huge success coming in 1987. And several sectors went into, you know, adapting ISO 9001 to the sector-specific standards, whether it's ISO 13485 in medical devices or ISO 29001 in oil and gas industry. There are a number of such standards, or even private standards where ISO did not make standards. For example, AS 9100 for aerospace sector, IATA 16949 for automotive sector. It's a surprise to me that healthcare did not go this way for these many years. ISO 9000 came in 1987, and this standard got published in October 23. So for 36 years, there was no harmonized international standard dedicated to healthcare. While healthcare, in the name of healthcare accreditation, you know and we know that a number of standards are going around and have been popular, but there is no internationally harmonized standard. So this is one reason for my curiosity about this standard. Second is more personal experience. In the last 5 years, I have been to 5 of the best, all I can say is, without naming them, 5 of the best hospitals in NCR, Delhi NCR. My mother is old and sometimes she needs treatment in the hospital. And every time I have gone to a hospital, they are all accredited. Mind you, they are all top class hospitals, all of them are accredited. Yet each time I have gone to these hospitals, I have felt, the absence of what was called in ISO 9000 customer focus. I mean, I have always felt that these people need to implement 9001 only for the purpose of that one part, which was actually the selling point of USP of 9001, customer focus, which to me appeared that seemed to be missing. Hospitals may have been giving wonderful treatment for all you know. I mean, if the patient gets well, all we are interested in patient gets well. But there's more to quality than simply patient getting well. So I'm just curious whether this standard would combine the technical rigor of the normal accreditation standard. You have an accreditation standard. NABH we know has an accreditation standard. JCI has an accreditation standard. Whether this standard would be able to marry the technical rigor of the accreditation standards along with the customer focus of 9001, so that when next time I go to a 7101 certified hospital or accredited hospital, I don't feel the same feeling that they are 9000 customer focus nahi hai. So I am here as an outsider, curious about this standard. And therefore, I logged in. And thank you very much for inviting me to speak and sharing some thoughts. These are all and normal, uh, common consumer, common user of hospital services thoughts, and not professionals who are probably attending your program. But they might realize that this is how a common man reacts when he goes to a hospital. They are on the other side, all those who are attending here. But I, on this side, react like this. So I'm curious about the standard. And of course, we should, as a country and as a community, I believe that we should welcome harmonized international standards in every sector. And our aim should be, our default thinking should be that we'll comply with international standards. There's too much of differential standards, only for India standards kind of talk going on. I don't believe in that. I believe our people deserve the best, and international standards are the best. They are not exactly the best, but they are the most commonly accepted standards. You can exceed them. You can certainly exceed them. And if we are exceeding them, great. But I believe that we should, our default thinking should be that we are going for international standards wherever they exist. With these thoughts, I'll hand back to Dr. Rana. Thank you very much for asking me to share my thoughts.
Thank you so much.
Otherwise, I'm a listener.
Thank
Thank
you
you.
so much, sir. Valuable comments. And I think that's precisely any standard should be meant for customer focus and customer service, whether it's a patient and non-patient. So I think that the standard should serve. And if some standards are falling short, I think we really look at those processes or even the content of the standard, see how we can really make sure. So let me start my presentation to take you through all little bit of something or little bit of something different, to give a flow of things, including what the question you were asking about, how it can be, helping customer focus approach for patients going to a hospital. So this webinar is focused on ISO 7101, which is published in October 23. So very new standard, which is management system for quality in healthcare organization requirements. So it's a management system standards, and as Jorishal mentioned, in ISO world is actually the certification standard. But now QI is trying to make use of the expertise we already have and the availability of the standards to provide to hospitals, owners, and the running organizations to adopt some of the best practices which comes from a harmonized standards globally coming from ISO. So a brief about QAI so that you connect with why we are talking about ISO 7101. So someone who actually have some interest and linkages to a 701, which is a healthcare quality management standard, is something we can talk about. So we at Quality and Accreditation Institute QAI starting accreditation operation in August 2017. We can say that we are one of the fastest evolving accreditation body globally, because in less than 5 years we have developed 15, not 14, 15 accreditation standards and growing. So what we offer we have verticals under our Center for Accreditation of Health and Social Care, which is a vertical for healthcare quality improvement and standards and accreditation. We provide a lot of programs. As I said, 15 isn't growing. So we have a program for clinic, we have ambulatory care facilities starting from a daycare surgery center or even dental center, medical imaging, or even ophthalmology center, and whatever can be on ambulatory basis. Hospital, definitely we have standard for hospitals, we have for home health care, we have transition care or out of hospital standards, including rehab, inpatient rehab, assisted living, de-addiction center, so on and so forth. And then we have a standard for telehealth, standard for hotels and homestays, which we developed during COVID-19, dialysis standards, IVF for heart standards, emergency department of a hospital, green healthcare facility, and which is now under revision. Patient safety standard from WHO is called patient safety friendly hospital standards, and obviously primary and advanced stroke center. So this is what at the moment we have. But in addition to now what we are coming up with our following program. So we are almost done with the draft of medical transport organization, commonly known as ambulance services. This is going to be the first of its kind in India, and I think very few accreditation bodies globally have these standards, maybe next three or four organizations around the world. And then in line with our stroke accreditation program, we are now coming up with we start developing the standard for heart attack. We call acute myocardial infarction accreditation program. And then hair transplant center. We just signed MOU with the hair transplant society, surgeon society in India. And then care homes. Care homes are basically a non-healthcare setup. We call them social care setup. A little bit of healthcare component when patient might need some care from a primary physician or nursing. But basically, they are care homes. They are also called retirement homes, or they can have assisted living. They can. There are varieties of name of this type of organization, and they are coming up with new names every day. But we have just finished the standards for them. QA 7101 plus, and that's why we all are here talking about ISO 7101 and how QI is moving forward with an accreditation program using the standard 7101. So I'll talk about that in a little more. So under our another vertical for international accreditation, we talk about mostly the lab accreditation, medical testing, calibration, biobanking accreditation program, and so forth and so forth. Some of the international recognition for our healthcare vertical, we are a member of International Society for Quality in Healthcare. External Evaluation Association is called EEA, which is an organization grants accreditation to accreditation bodies and their standards. So we are the body which is approved or accredited by EEA, and we got it in less than 5 years, so we target for 3 years. But COVID-19 has pushed us 2 years for adding into 3 plus 2, 5 years. We have home care standards, our hospital standards accredited by ISO also. Our program for hospitals and eye centers, dental and imaging is approved by Ministry of Health for CGHS empanelment as equivalent to NABH. So hospital have choice, or dental centers or imaging centers have a choice to go to NABH or to QAI for CGHS empanelment benefits. On our laboratory side, we are mutual recognition arrangement or full member of Asia Pacific Accreditation Cooperation and International Laboratory Accreditation Cooperation, ILAC, giving us national and international recognition and equivalence in this field for testing and medical ISO 7025 and ISO 15189. And we are also recognized by some of the international organizations, like 2 of the US regulators, United States Environmental Protection Agency, US EPA, has approved QI accreditation for formaldehyde testing in wood and wood products, and also United States Consumer Product Safety Commission, US CPSCA, for any product getting into US need to be testing in a laboratory which is accredited by an approved accreditation body. So QI is one of them. And we also are approved by World Organization for Animal Health. Earlier name is OIE, which is like a WHO for animals, actually. Like we have World Health Organization for humans, so this is for animals. One of our lab, which is accredited by us for rabies testing laboratory, is approved by WAH as a rabies referral laboratory, first in India, first and only in India, and which is third in the whole of the world. So this is our international. We are also member of International Society for Quality in Healthcare, board member of International Society for Telemedicine and e-health. This is our gold seal, mark of sustained quality, and accredited conformity assessment body or organization can use them. We are a little bit spreading across the globe, but at least in the region. So we are working at the moment in 10 countries, as you can see on the map. And there are a couple of other countries work in progress, as is listed on the right side of the slide. So this covers Asia, it covers even Middle East, and then even African countries, and also going towards North America, because we have some interest from Canada also. So this is how we are trying to spread both in accreditation programs. Now, that's about briefly to link and connect with what we are talking about 7101. So what is ISO 7101? So ISO 7101, as you heard from Mr. Jory also and from my opening slide, is a quality management system standards coming for healthcare organization for the first time, and is developed by ISO 26304 Working Group 5, and I happen to be one of the member of this working group to write these standards and use our expertise in last several years, which we gather from accreditation program globally. So ISO 701 is the first international management system standard for quality in healthcare organizations. And as Mr. Jory was talking about customer focus, and obviously because it's in a management system standard. It's aligned with ISO 9001 because ISO 9001 was the first management system standard, and this is now actually now oriented toward healthcare. So it prescribes requirements for a systematic approach in sustainable, high quality health systems. So this standard, we call it document, provides requirements for management systems for quality in healthcare organizations. This document or the standard conforms to ISO requirement for management system standards. As I mentioned, ISO 9001 basically management system standard. And the requirements which have been written down in 711, harmonized structure, identical core text, and common terms with core definitions designed to benefit users implementing multiple ISO management system standards. So as Mr. Jory mentioned, multiple set of standard 9,000, 14,000, 18,000, and 13485, many. So most of them are management system standards. And so this standard is also written on the same lines, following the ISO philosophy of writing standards, global harmonized standards coming from ISO, which is a global consultative process for developing any ISO standards. So use almost same, philosophy of writing the standard using the definitions and terms which can be linked with each other in many set of standards. And this document with the standards contains the requirements used to assess conformity. So this is the conformity assessment document you can check as a certification standard, which is for conformity assessment. So that's about what ISO 711 is. But going into more detail, why is 701 important for healthcare organization? How it is going to add value to healthcare organizations, in addition to if any hospital or any healthcare facility organization is going for 9001. So what is special in this? So what is special? There are many things which are special to 7101. Start from creating a culture of quality, starting with a strong top management commitment. So any quality management system standards or any quality improvement program actually is a top-down approach. The top-down approach means it has to be coming from top, from the top management, who are the decision maker, the leaders of the organization. So their commitment is very, very important. So it actually starts from there. It sets the culture of quality. When the management decide that yes, they need to establish standards and provide services in a manner which is customer focused, which is people-centered care or person-centric care or patient-centric care. How you really demonstrate, you actually have a culture of quality. So it's not that culture which you can incubate in a plate and in micro as a microbiology plate. It's not that culture. So, but it has to be that how you can really assess it as a culture. So management has to demonstrate its commitment by adopting standards, by adopting best practices, by providing adequate infrastructure, resources, whether it's man, machine, environment. And in order to say that, yes, we are able to put together things to maximize benefits for our people. Okay. Thank you. Manish tell me that my voice is a little lower. So I speak a little more louder. And also it helps in embracing a healthcare system based on people-centered care, respect, compassion, for the co-production, equity, and dignity. So these are the keywords I'm sure many of you might have come across before, but if not, so these are very, very important keywords in any standard.
Sorry
People-centered
to
care.
interrupt you. Your voice is still a bit low. Participant could not able to listen clearly.
Are you able to listen me? Let's check. Are you able to get me now?
Audience, will you please confirm?
Are you getting my voice?
Yes, sir.
Hello?
Yes, sir.
Okay, good. Thank you. So what is people-centered care? People-centered care means that patient in the center, the family around, and then community around, which means it's not just patient, because many times patient is not able to take the commands of doctors or nurses. Patient is not in a situation to self-administration of medication. He needs or she needs attention, she needs support. So family members comes handy. So if we don't involve family members in the care of the patient, we may not provide adequate care because we might miss many things. So that's why the approach of people-centered care. Respect. We have to provide complete respect to the patient, irrespective of what background he or she comes from. Compassion. So now WHO is taking it very seriously and taking a lot of agenda around compassionate care. So how compassionate care can help and support people in getting better. Co-production. Co-production means any steps, any policy, any procedure, any healthcare organization develop, it should be co-produced. Co-produce means not just one entity. It can be staff, it can be any other stakeholder, it can including patients or service users, even doctors, nurse, or any other outside stakeholders. So it takes views of multiple stakeholders to produce something called co-production. We call it co-creation and co-production. Equity. Equity means providing equal opportunity of treatment and care to everyone, irrespective of their background, sex, creed, or whatever way it is. You are not going to differentiate people from their background or their economic or socio-economic status or whatever it is. Everyone receive same amount of care as anyone would have. That's about equity. Dignity. Yes, every person deserves dignified care. Okay. And then it also helps identify and address risk. So there are a lot of attempt has been put onto this standard to uh, how to identify potential risks, how to mitigate those risks. So there's a lot of things around risk because risk assessment, risk management strategies really help organizations to do better. It helps ensuring patients and workforce safety and well-being. So it's not just patient safety, it's about workforce safety. Workforce safety means the people working in the organization. Safety and well-being. So during COVID-19, everybody realized that it's not just patient safety, but the staff safety is equally important. Because if staff is not safe or staff don't feel safe in an environment which they use to provide care in, they might not deliver better care or the best care to their best level. Because in like COVID environment, if staff is fear of getting COVID-19, then he or she will not put the focus on the patient care. So in order to give the best care to the patient, safe care to the patient, staff need to be assured, reassured that they are safe. So this standards touch upon not only just patient safety, but about staff and workforce safety and well-being. So well-being is goes beyond safety. Well-being means how you provide opportunities to an education to patients and workforce, whether like no smoking, healthy diet, use of importance of exercises. So these are the things which actually helps in well-being of the people. It also helps in controlling service delivery through documented processes and documented information. So now as a healthcare service provider, when you deliver healthcare services to a person as a patient, then how you really deliver it, how you make sure that they are standardized, how you ensure that every staff using the same method or providing the same thing, so that is done through documented processes, documented procedures, documented policies, and documented information. So everything is written down. So whosoever is associated with that, whosoever is interested in that, they follow the same rules and minimize the gap, minimize the variations, and so on and so forth. Similarly, the standards this also helps in monitoring and evaluation of clinical and non-clinical performance. So this is about the performance measurement using the indicators. So there are some indicators defined in the standards also to help and support organizations to know where they are in terms of a specific indicator or the performance, and then they can improve upon. This also helps in continually improving the process and the region. So when you document some process and you start working on implement it and use it, for a period of time, and then evaluate how it is functioning, how it is giving you the results. And you might come across that there are certain things need improvement because you have learned from your experience in last months or last 6 months or a year or so. And then you might think to improve on those processes. And obviously, when the process will improve, your results might also go up and improve. So this is how the 7-1 actually helps a healthcare organization in providing the better care to the patient. So that's why we say why you should choose ISO 701 or you should choose 701 standard to adopt because this helps in all the entire ecosystem, or I would say whole care continuum of a patient, starting from getting into a healthcare facility, during the stay in a healthcare facility, and then discharge from the healthcare facility. And it's an ongoing basis. In also, it also I have we have tried to highlight some of the key aspects of this standard. In addition to I just spoke some of those important points as well. That it's also having patient-centered care. As I also mentioned, patient-centered. What means it emphasizes unique needs of the patient, individual patient's needs. It's not just patient needs across the organization or whosoever comes. No, individual patient needs. Okay, preferences and outcomes. Some might have preferences for special diets, some might have religious preferences, some might have spiritual preferences. So all those have been part of this standard. Legal and regulatory compliance, obviously very important. The standards says that at many places that whatever applicable legal and regulatory requirements as applicable to a specific type of healthcare organization applies. These standards require the compliance to that, which means whether an accreditation body like us go and evaluate an organization for this standard, we would also look at what are the legal or regulatory compliance are applicable to you. For example, one of the common example is biomedical waste handling rules and regulation. Because as a healthcare facility, you generate biomedical waste, so you need to be licensed under Biomedical Waste Act. Similarly, for other procedures like for medication, if you medical license for pharmacy, in case of narcotics, you have NDPS license. So there are several, and because this is a global standard, the standard does not mention a specific name of a specific law or regulation, but it generic says that the organization need to demonstrate compliance to applicable regulatory requirements. So it becomes the responsibility of the healthcare organizations to list out what are the regulatory requirements are applicable to that type of organization and then demonstrate the compliance. Global consistency and interoperability, that's very, very important. As Mr. Jory also mentioned that because these standards are global, harmonized standards coming from ISO, so it establishes a common framework for healthcare quality management across border. It's not just one country, two countries, everywhere in the world. It also ensures organizations worldwide adhere to consistent standards, facilitating collaboration, data exchange, and best practices. So when everyone, if there are 10 hospitals, for example, 10 clinics, they use the same standard, so they will align to the same standard, their practices, and so on and so forth. Risk management and patient safety, as I already touched upon, it has a greater emphasis in the standard. Navigating complexity. So healthcare system, healthcare delivery system is a very complex system. It is already established because there are so many players in the delivery process, and therefore it is important that how this complexity is addressed, how this navigation of information from and between and within the organization flows. So this standard provides a structured approach to manage these complexities effectively, and that is what is important. Whether this is coming from a limited resource organization like country, limited resource country like lower middle income countries or middle income countries, countries which have resource limitations, and aging population, chronic diseases as we come across from different countries, and global pandemic. So this also talks about all these issues in this standard. Urgency of adoption. So as we have seen during COVID-19 that things have changed, people people have changed their own methodologies, processes, and so as the technology and also adoption of technology. Telehealth came into being because of virtual care. People were not visiting any healthcare facility because of COVID-19 fear, and they were closed. So how they were getting so virtual care, telehealth, telemedicine came into being. So that component is also included into the standard. Quality metrics for improvement. So any standard should also be consider components for improvement. How the organization can sustain over a period of time and demonstrate the continual quality improvement. So this standard offers key quality metrics that organization can implement. It also drives higher and better quality across healthcare systems. So it's not just organization but healthcare systems. And I will come to you what does it mean in a short while. So agile response planning. So agility, sustenance, how organization can sustain over a time in different conditions, different situations. Like pandemic, specific response plan based on 711 is also addressed in case how you come across such thing, how you will plan your services, how you will plan your delivery of services. And they also touch upon resource allocation and so on and so forth. Risk assessment and mitigation will come up again and again. Resource optimization, how organization works to allocating resources efficiently, how they can help in redesigning the facilities, and also use the tools which can help in delivering safe care to the people and also to staff. Innovative surveillance techniques, how you track and trace events, how you track and trace adverse events or sentinel events, or any case for that matter, how you can use technology to collect data, collect information and analysis, and the use results for improvement. Collaboration and information sharing is another important aspect of this standard. The standards require collaboration, between healthcare organization and different agencies, governmental, non-government agencies, like-minded organizations come together and work together to see how they can really supplement and complement each other's efforts in providing better outcomes. Share best practices, research findings, and lessons learned. So this also, if somebody is involved in research, then how they can involve, what ethics and ethical criteria they need to consider, that also uh, find a place in this standard. Adoption virtual healthcare, already talked about. Emergency preparedness deals is about that any healthcare facility, for that matter, any organization, including healthcare, need to be prepared for any emergency situation. It can be a a disaster situation, it can be a man-made disaster, it can be a natural disaster. Natural disaster like earthquakes, tsunami, or even biological threats like pandemics. So the organization need to be, we call it emergency ready organizations. So they need to conduct drills, how they will know what to do in case there is something happen like this. So there are protocols to be documented. People need to be made aware of. Staff need to be provided training on all those, and then there should be a practice. So drills in case hospital need to be evacuated in an emergency, say a fire happened. So hospital now need to be evacuated. So how the evacuation will happen? It will not happen until the people are trained. It will not happen properly if the facilities are not available to firefight and all these things. So all those things are provided through training and drills. So that you practice it in case it is required in unforeseen circumstances that can be effectively managed. So that's about why and then what are the contents there. Now it's called who is it designed for? Means what type of healthcare organization it is applicable. So this is say the healthcare organization. So it means it covers all types of healthcare organization. But how they define it? It says 701 has been written with a focus on providing requirements for healthcare quality management. Okay. Now, what are who are the target audience? Target audience is quite broad. It's not just restricted. It is broad enough. It includes healthcare system. What is healthcare system? Like we have in India, we have different states, and every state has healthcare system. So like UP health system, Karnataka health system, Tamil Nadu health system. So the healthcare system works across the states. That's a healthcare system. So even a complete healthcare system can also adopt these standards and implement it. We have not seen it here in India, but yes, in some part of the world, like I know about Canada, that Canadian accreditation body have a program for complete healthcare system where they go to the province. They call it province like we call it states, and they accredit the entire province for the healthcare delivery system. So it is applicable to healthcare system. It is applicable to organization or entity that aims to increase the quality of its healthcare delivery and care outcomes. And now, who can these organizations be? These organizations can include ministries of health, public and private healthcare systems, hospitals, clinics, non-governmental organizations, and agencies that provide healthcare services and more. So it's applicable to any type of healthcare organization, starting from as small as a clinic, and it can be as go far and far like a healthcare system. That's the applicability this standard has kept in mind for. Now, one of the basic philosophy of developing these standards is use a PDSA or PDCA cycle, which is in existence, Deming cycle, in the name of Deming cycle, 4 years together. Any QMS guru or teacher or student would understand what PDCA or PDSA cycle is, coming from Edward Deming, which actually focus on leadership. As you see the picture in the right side, is in the center is the leadership, is the core component. Okay, and then it's about planning. It's planning about what you have to do, what research or planning you have to make sure to deliver the services through action. So this is a philosophy, and it's evolved around a core component of safe care, which is actually based on World Health Organization (WHO) definition of quality. So what is WHO define? What is quality of care? So quality of care is which is safe, which is efficient, which is effective, which is people centric, which is timely, and which is equitable. So in the outmost circle, you say find these components of safe care, and then in the inner circle of that you will find all these, and then they are also related to the clauses of the standard 5, 6, 7, 8, 9, 10 in the center. So this is the whole philosophy used to develop these standards in the core. And let's say class 4, class 6, 7, 8, 9, 10 has been referred in this model of care. Now coming to what QI is thinking about. QI initiative on ISO 7101 is to develop a standard based on ISO 701, and we are naming it called QI 7101 plus. What does it mean? It means mapping and amalgamation of ISO 7101 and additional requirements of the facilities of different types of organization, which will lead to having a document called QA 7101 plus. So we have already worked on it, developed it, and we are planning to launch it very shortly. So what it will help in providing accreditation? Because we always say accreditation standards provide framework for structures, processes, and outcomes. Okay, and standards play an important role in quality and patient safety, and and most importantly, that is already there everywhere in any quality. But the important part of accreditation is it helps in providing continuous oversight to ensure sustainability of the processes. Accreditation is not a one-time activity. It's not in a project mode. That project is there for 3 or 5 years. Once the project is over, everything is finished. No practice is left behind. It's not. So accreditation, that's why it's considered a very important quality improvement tool, because through the process of accreditation, there is a continuous oversight by the accreditation body on the healthcare organization to see whether they are continuously complying with the requirement of their standards and demonstrate their commitment and compliance to that, so that they don't go back to the basics or primitive states. So this is the framework of ISO 7101. So there are clause 1 to 10, and 1 and 2, 3, they are introduction, then summary, background, and then terms and definition. But the major requirements which are prescribed in different clauses are actually clause 4, 5, 6, 7, 8, 9, 10. So these 7 clauses, 4 to 10, are major requirements prescribed in this standard for any healthcare organization, and they are context of the organization. And this clause contains 4 subclauses. Like if you know the method of ISO standard, like there are clauses, subclauses, and subclauses to subclauses, subclauses like 4, 4.1, 4.1.1, 4.1.1.1, like. So this is how the standards of ISO are written down. And clause 5 is about leadership, and it has 5 subclauses. The 6th clause is about planning. It has 3 subclauses, and then support mechanism. What support services required by organization find place in clause 7, having 5 subclauses. And operations, the entire operations, clinical, non-clinical, find place in clause 8, and this is the largest clause 8. And as you can see, there are 12 subclauses, and that's why it is the largest clause, because this is about the operation of the entire organization. Clause 9 focus on the performance evaluation. As we talk about the performance measurement, performance indicators, and all these things, has 3 subclauses. And last but not the least, clause 10 is about improvement. So whatever you do in clause 4 to 9 you have to demonstrate improvement through different processes, through benchmark, through matrices, and that has two subclauses. So in all these 7 clauses has 34 subclauses, and obviously there are many clauses. Just to give you an orientation how this is standard, because in 1 hour we can't go through the entire standard, so we try to give you a snapshot of this. So as I say, the clause 1 is about the scope, which I mentioned that to whom this is applicable for, who can join this standard, who can implement this standard, adopt this standard, and how it is. And then some of the normative references, cross references related to this standard, like 9001 and many other standards which are find commonalities in this. And then obviously third about terms and definition used in this standard for the benefit of the users and the implementers to understand what they mean. And then from clause 4, 5, 6, 7, 8, 9, 10 are the main clauses. So first is context of the organization, and I mentioned 4 subclauses, which talks about understanding the organization. I mean, what is the purpose of this organization? What is the purpose of hospital clinic? What are the services they are providing? That will come in 4.1. Then how they develop their services, understanding the needs and expectation of the stakeholder. So organizations need to identify who are their stakeholders and how they meet their expectation and needs. Determining the scope of management system for quality in healthcare organization. Now this is the standard which is for management system. Which area you are going to apply for? You can start with say a specific division and section, and then you slowly cover the organization. So you have to define and determine and define what scope you are covering. Is a complete organization, or you are just integrating into one department. So you have to clearly define that this has been implemented to this part of the organization or whole of the organization. Management system for quality in healthcare is just basic management system requirement as any management system standard would have, including 9001. Then obviously the leadership. Leadership means how the leadership is committed, what leadership mechanism they provide, what is their quality policy. So they have to also write a quality policy in line with their own vision, mission statements, roles, responsibility, and authorities in a broader sense. Many things will come in the operation and human resources personal clause, but here it talks about the roles and responsibility and authorities at the larger picture and the leadership and management level. Service user focus, and this is what I was mentioning, and Mr. Jody raises his remarks as well, that what about this standard in terms of service user focus? So this is very important. Is put as a service user focus 5.4 in relation to that. And then access to care. So why we are not telling that? Just a moment. People say that voice is very low. Just give me a moment. Let me just speak like this. Can you hear me a little better now? Manish, can you confirm?
Yes, sir.
Full clarity.
You can hear
No,
me?
yes, it's clear.
Okay, thank you. So that's about leadership, different roles, service user focus, access to care. Access to care means how people can access the care, how what mechanism like user friendly, disabled friendly, and what are service and all these things. Then planning, which is the last one clause of this, action to address risks and opportunities in general. What is the risk culture, risk management processes, and then quality objectives and planning to achieve that. So organizations had to define the quality objectives, 1, 2, 3, 4, and how they are going to achieve that, plan for that. Planning of changes. So if in future organization plan to make some changes, whether in the infrastructure, whether in terms of services, they need to be planned ahead so that not to disrupt the services which already being offered, and there should be a smooth transition during that change. And then similarly for support, clause 7 is about the support, that support for the entire organization in terms of resources, in terms of competence in general, and awareness about the services being delivered. Then communication is very important in general, service user communication, that how communication flows from one point to another point between the service provider like nursing or doctors, and clinical communication related to patient, how they are flowing either from the laboratory or from blood bank, from operation theater,
And external communication, anything coming from outside, whether they are any stakeholder or regulator, how the external communications are managed. Then documented information, and that's very important for a quality management perspective, that creating and documenting and updating information, control of documented information, information management system, which may be paper and electronic, either way, control and management electronic information, and audit of records. So whatever records you generate, that you how you audit to find out whether what you are doing were right or wrong, and everything is in okay. Operations, operational planning and control, healthcare facility management and maintenance. So how the facility is managed is a physical infrastructure, contingency planning for facilities and services. In case of any problem happen to organization, facilities or services are disturbed, how you will manage those. And equipment management. So how you select equipment, how you manage them, how you maintain them. If required, calibration is to be done. So it's annual maintenance plan. So this is all about equipment which are used in clinical services and even the non-clinical services. So all equipment comes in there. Then waste management, obviously the waste management actually general waste and biomedical waste both are covered. And this also focus on environmental responsibility, that how you can help in reducing the waste. So waste reduction, use of environmental friendly resources and policies and practices, all these things come there. And then handling and storage material. So material, like you define what material, like consumables and different chemicals or different biological things or anything which you are using, how you handle them, how you store them so that they don't lose their sanctity. Service user belonging. So obviously the patients comes, and if they bring some, they having clothes, they have maybe ornaments, something. So how you make sure that they are safe. So do you provide a place for these things to be safe, securely kept? So this also talks about, which is very, very important. Emerging technologies, like we talk about AI, we talk about machine learning, we are talking about many other things. So what are emerging technology coming up, and whether organization is embracing those emerging technologies for making their life better. Service design in healthcare, that is also again very important, that how the services are designed to meet the requirement of stakeholders. And that's why I say the consultation in the previous part, the first clause is that how they understand the stakeholder needs and design services. Supplies and services from external provider, anything coming from outside, whether you are buying a reagent or chemical or any other supply, including consumables and services. The example of service like housekeeping services, maybe security services, if you want to get them from external agencies and providers, how you select them, how you will monitor their performance, so on and so forth will cover here. Then provision of services. So what services you are offering, different types of different provision of services to offer them. Then is 8.10 is focused on people-centered care. And this is about the very, very core clause of the standard, people-centered. It lies how to collect service user experience. And after collecting service user experience, how you design, how you develop, how you modify or amend your practices to make it better, giving the better experience to the service users. Compassionate care, inclusivity, diversity, health literacy, co-production, workforce well-being. So this all 8.10 talks about the people-centered care. Ethics, yes, 8.11 talks about ethics. So ethics comes like when you are doing research, so you follow ethics protocol, providing services, charging patients for the treatment or service, how ethical you are. So those is revolve around all the ethical issues. Patient safety has a special clause 8.12 is patient safety. It include couple of very important aspects of safety. First is knowledge and learning and safety, patient identification. So many times patient is not properly identified, so wrong patient given the wrong medication, wrong treatment, everything happens. So patient identification is very, very important. Medication safety, wrong medication, wrong time, wrong dose, wrong route, it happens. So medication safety, the second largest cause of medical errors in the world. That's why it's find a place here. Same thing, surgical safety. In most of the surgical procedure, there is an incident, there might be an incident. So there is a use of safe surgery checklist from WHO. Safe surgery saves lives, because that's also identified as one of the most critical aspect. And I think recent report, I think a day before only I was reading a report from India that more than 44% of medical problems errors are happening in surgical area. and that's why it's five phase. So it's a surgical safety, medication safety, identification, and obviously infection prevention and control, which is very, very important for anything. How you develop your policies for prevention and then control, how you identify people to high risk people for getting infection and how you protect them. All these finds place into 8.12.6. Prevention of falls, pressure ulcers, and thrombolism. So these are one of the common areas where the patient fall happen and they get sustained injury. Pressure ulcers for long-term care in a patient in even ICUs or patient on ventilators as well. Chances of patient pressure ulcers goes up if you don't provide proper care, don't change their positions from time to time. All these things and thromboembolism. If you don't change position, in addition to ulcer, thromboembolism also develops. So all these things are patient safety risks which are identified in the standard. Diagnostic safety related to diagnostic, and diagnostic errors are another significant area of medical errors. And blood transfusions, wrong blood, wrong group, blood reactions, and all these things. So these are very critical things put into the standards for patient safety. Now, last but not the second last is performance evaluation, that how organization actually monitor, measure, and analyze, and then evaluate their indicators. So, the organization has to define the indicators, performance indicators, start collecting data on that, to start doing one measurement and monitor their performance, and obviously the data which they analyze for evaluation gives the opportunity to improve. So it's about general requirements. So in most of the clauses, you find the first sub clause is general. It will actually lay down the principle of that clause, that what does actually means and what is actually requires in general. So that's why you will find general, general, general everywhere in each sub clauses. Then healthcare quality indicators that they need to be defined. What methodology used to be to be used for collecting and analyzing these indicators, and then coming out with the results and use of that results for improvement. And as like for any other management system standard, two important thing: internal audit and management review. So this comes from traditional standard for management systems. Internal audit, that organization is required to do internal audit and develop an internal audit program, implement that internal audit program for finding the points for improvement, and then work on those the points so that you can really make use of that audit program in improving the care for the patient, or even your processes, your anything which can come through the process of internal audit. And the frequency, we have also defined frequency. Yes, I think once in a year, once in 12 months precisely, it should be done. And management review is a process whereby management is being, informed about what's going on. So we have defined inputs and the results of the what should be the agenda points as inputs to the management. And obviously one input is the report of internal audit, and then management need to discuss on those input points, agenda points, and then come out with decision action points, which comes into the management review results. And clause 10 is about improvement on continual basis, through obviously performance evaluation is there, but how you use them into putting as a system for continual improvement on an ongoing basis. Identifying non-conformity and appropriate corrective actions. So management of non-conformity. Non-conformity is something non-complying to requirements prescribed in the standard. So if something is not being complying, it's called as non-conformity. So once that is identified, either through the process of internal audit or by through process of stakeholder consultation or by complaint mechanism or by staff feedback or people feedback. So you can use any channel of identifying non-conformity. It's not just one way of internal audit is one of the most important. External audits also to identify areas of opportunities for improvement. And obviously, once they are identified, you need to put an action plan as a corrective actions. And I'll go beyond the risk assessment, actually, the preventive aspects, how you really make sure that these things will not come across again. So this is all about the standards in outline. So QI 7101 plus, which we have developed, is basically based on ISO 7101. But what we have done is we have supplemented these requirements at many clauses and sub-clauses, which require some attention. For example, it talks about ensuring the rights of patients are clearly known. So until as people know what are the rights, they will not be known. So just saying that patients' rights are known may not be sufficient, because first it is very important to highlight what are the patient rights, 1, 2, 3, 4, 5. Once that is listed out, then you start implementing and then communicating to patients, these are your rights. If anything is being violated, you can raise your hand. So we are trying to supplement 7101 with additional interpretation, additional requirements, and as it is applicable from a clinic to a system, healthcare system. So this will be a quite flexible and ongoing document. It's not going to be just a one frozen document. It can be, it can change from institution, organization to organization. Suppose a blood bank comes up, a medical imaging center comes up, so they have separate requirement, right? How to identify blood component, blood products, and all these things, and then all these things. So we will supplement depending on the type of the organization specific. We can supplement the requirements in different clauses of the standard, obviously. So that will give us, that's why it's called 7101 plus. We are adding the requirements and using that document to check the conformity through the process. And we also do to make it easier for everyone to understand. Like this webinar, we conduct this webinar like this. We also conducted a pilot in a hospital to check whether that hospital complies, and they give us a gap analysis report, what they comply, what they don't comply, what need to do additionally, and then so that's how that helps us to understand how deeply it can be implemented and what are the challenges hospital might face. So that has been a quite good pilot. And we also have developed a program called Implementer Come Internal Auditor Training Program. It means it will help whosoever attended, will help them understanding the standards, all the clauses. We talk about clauses in detail, one by one, and then also the internal auditing techniques, the process of conducting internal audit. So people who train under the program will know the standard, and they can go back and check, conduct the internal audit also for themselves and for other organizations. So that's how we trying to work on. So thank you so much, all of you, and we would be happy to take questions from you. Thank you. Over to you, Manish.
So we are now open for the queries and doubts. So if anyone having, please go ahead.
People can type in chat, or if they want to speak, they can unmute and they can speak. I get a question from Swarupa. What eligibility for what? I see a hand from Survey. Yes, please, Survey.
Good afternoon, sir.
Yes, please.
Sir, wanted to ask, ISO and this uh, international standard, which is like this AACI, is it same or different?
No, it's not same and it's not different. I would say like that. See, there are different organizations providing accreditation and certification services. ISO is not an accreditation or certifications provider. ISO is a standard developing organization internationally, international organization for standardization, right? So ISO do not certify or accredit any organization. They only develop standards globally. And I see Mr. Jorib already put ISO only sets standards. So many people may not aware, they find ISO certified, so they think the ISO certified. No, ISO don't certify. They only develop standards. And the organization you mentioned, they are accreditation bodies like AACI, QAI, NABH, JCI. So there are many accreditation bodies, and there are certification like Jody mentioned, certification bodies certify against ISO standards. So it goes in like in the medical lab. There is an accreditation as per ISO 15189, 17025 for testing lab. Similarly, there is an organization to certify against 9001, can certify against 13485 for medical device. So there are certification standards used for certification. So please keep this in mind that ISO do not go into accreditation or certification of any organization. They are just developing the standards which are used by different stakeholders for different purposes. And then there are accreditation bodies and certification bodies. they are separate. So you should be very careful. And I think see Joris are typing. If anyone claims yes, so and many times I see claiming wrong ISO certified, and they put ISO logo and all these things. This gives that ISO is certified. No, it's not. So if somebody is claiming, you can raise the alarm. Thank you.
Thank you, sir. So it is like certification which can be taken for when we like apply all these standards.
Yes, so as Joris have also mentioned, this is actually an ISO what all accreditation in healthcare which we are doing actually is site certification as per ISO definition. But forget about that at the moment, because in healthcare we have been now like NABH in England for 18, 19 years, JCI for many years, QI for 7 years. We call them accreditation bodies. So whatever we do accreditation. Okay. But if there are, certification bodies, they do certification. What we are talking at the moment here, QS 7101 plus accreditation, because we develop an additional requirements for the standard based on 7101.
Okay, sir. Thank you.
So if somebody says that I'll get you ISO certification from ISO, that is not possible. Any institution or organization can be certified or accredited to an ISO standard by accreditation or certification agencies, not by ISO.
Hello, sir. This is Dr. Swarupa.
Yes,
I
please.
just wanted to know about for internal auditor training for 7101. Is it mandate that we should have from a healthcare system, or anyone can do?
No prescribed qualification. Anybody
Okay.
interested can attend,
Okay.
because that's not defining quality for a auditor or assessors, which may be different to go and evaluate. Assess
Many
the
times, sir,
organization.
what happens for 15189, we do internal auditor training, but when we go for SSS training, the requirement many times come that we should have MBBS
Definitely.
MD qualification.
That is why I gave you example. The internal auditor and assessor training program totally different thing. The purpose is totally different, and the requirements to join programs can be different. So for internal audit, because the purpose is totally different, anybody with any background, depending on what he or she want to gain, can attend. There is no prescribed qualification for that. But for assessors, yes, the qualifications are experience are prescribed, specific.
Yeah, thank you.
Thank you.
Any other query?
Anyone else? So you can give feedback. Manish has posted, but before we close the session, I would again request Jory sir for the closing points and maybe some learning points and what he thinks about it. Thank you, sir.
Thank you, Dr. Bikaran and Dr. Anil sir, for your valuable knowledge for sharing with the participant. So there is a one more announcement from QI. So we have scheduled ISO 7101 internal auditor training in May month from 23rd to 25th of May. So those who have registered over there, we will share the program details on their mail ID, so they can register yourself, and they can also recommend some other healthcare professionals for the same. And I have also dropped a message for the feedback form. Please do share your valuable feedback and also mention your correct mail ID. So we'll share, like issue the certificate for attendees also.
Okay. Thank you, Manish. So I think if there are no more question, we can close. Thank you everyone for
Thank you everyone for
joining.
your
Thank you for your
presence.
time. Thank you. Have a nice day.